Hi friends, I'm Dr. Phani Krishna Ravula. I'm a liver and pancreas specialist and a liver transplant surgeon. July 28th is World Hepatitis Day, and on the eve of World Hepatitis Day, today we will discuss a few common questions related to the hepatitis. So when we talk about hepatitis is basically any form of inflammation of the liver. The World Hepatitis Day is mainly concerned with viral inflammation of the liver. When there's a viral infection in the body and that affects the liver, it's called viral hepatitis. So there are many types of viral hepatitis. Among the viral hepatitis, we have hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. And in addition to that, there are other forms of viral hepatitis, like when you get dengue or when you get chikungunya or even COVID, the virus can affect the liver and cause hepatitis. Among these various types of hepatitis, the main concerns, the hepatitis A, hepatitis C, and dengue, those kind of hepatitis are acute viral hepatitis. That means they cause hepatitis, patient gets the blood tests get deranged, the patient gets jaundice, patient has a period of illness, but almost 99% of the time, they actually recover, 99% of the time. Sometimes these acute viral hepatitis can unnecessarily take some native medicine and the local Ayurvedic, homeopathic and kind of native medicines, and they can get something called drug-induced liver injury, because of which their livers can actually get damaged. But if they just wait and take some liver-specific medication, the acute hepatitis, all this hepatitis A, hepatitis E, and dengue and other forms of viral hepatitis are usually self-limited illnesses which resolve on their own. On the other hand, hepatitis B and hepatitis C are different from the other kind of hepatitis, and the World Hepatitis Day is mainly concerned about these hepatitis because they cause something called chronic liver disease. That means once the virus attacks your body, it doesn't go away. The liver, after the initial infection of the liver in which the liver swells up, the virus continues to stay in the liver and in the body, and over a period of years, sometimes over 5 to 10 years, it completely damages the liver. The liver becomes scarred and diseased and scarred, and the patient ends up with either liver cancer or end-stage liver disease, in which the liver fails and the patient dies unless he has a liver transplantation. So basically the two types are the acute viral hepatitis causing hepatitis A, hepatitis E, dengue, COVID, and so many other viruses, while the main concern for us is the hepatitis B and hepatitis C. Now, hepatitis B and hepatitis C are a very big problem worldwide, or even in India. The prevalence, we estimate that approximately 3 to 4 crores of the Indian population has hepatitis B, and about 1 crore of the Indian population has hepatitis C. As you know, that's a huge burden of disease, and these hepatitis B and hepatitis C are very serious because they can lead to a lot of deaths. On an average, in the world, there's approximately 1 patient dies every minute because of the hepatitis-related liver diseases. So the common symptoms of hepatitis, like I said, there are 2 forms of symptoms. One is acute viral infection. So a patient is absolutely normal. He develops an acute viral infection. The patient will have malaise. Malaise is a very subtle kind of feeling of unwellness, feeling of weakness, feeling of lethargy, and that kind of subjective symptoms. As with sometimes low-grade fever. Usually viral hepatitis does not lead to high-grade fever. Low-grade fever, decreased appetite, malaise, these kind of symptoms, following which they can have jaundice. And this jaundice and lethargy persists for 2 to 3 weeks. And after that, it subsides usually in acute viral hepatitis. And if in these kind of patients, if the symptoms persist, that patient has noticeable yellowness of the eyes and noticeable severe weakness and severe lack of appetite and lethargy, then they should meet a doctor, because the doctor will actually evaluate them to find out whether they have only an acute viral hepatitis, a recent onset illness, or do they have underlying chronic liver disease. So it's very important to differentiate that, because the treatment and the long-term implications of these two are totally different. On the other hand, chronic liver disease can be like hepatitis B, hepatitis C can cause something called chronic liver disease. Chronic liver disease is a very, very slow process. The manifestation in the early years, as your liver is getting damaged, you won't have any symptoms. Then once the liver starts getting further and so you can classify them as stages: child's A, child's B, child's C, like that. In child's A, you'll have hardly any symptoms. Once the liver progressively the damage get worsened, what you have is again patients complain of weakness, patients complain of hair loss, patients complain of muscle atrophy. Their face becomes sunken, the muscles become all shriveled. Then they'll get the breasts become enlarged in the men and painful. They'll get swelling in their feet, they'll get fluid inside their tummy, and they can get blood vomitings, they can have blackish stools, blood in their stools, and many such symptoms. One thing we should realize is that hepatitis B and hepatitis C cause chronic liver disease, but chronic liver disease is not always due to hepatitis. There are several causes. They can be due to alcohol, they can be due to metabolic diseases like Wilson's disease, hemochromatosis, and there are many, many causes. So once you have any of these symptoms, you have to go visit a doctor. And especially for jaundice, it is not always due to infection. There are several other causes of jaundice. Bile duct stones can cause jaundice, pancreatic problems can cause jaundice, blood disorders can cause jaundice. So never ever go to a non-specialist or a native medicine practitioner and take unnecessary native medicines for jaundice without a proper evaluation, because in fact most of the patients in our liver ICU are patients in whom the jaundice we could have just waited it out, or the simple treatment was simple. Unnecessarily they've taken some native medicine and complicated the course of the disease. So when a patient comes to a doctor with symptoms of malaise, weakness, and jaundice, we suspect hepatitis. We get basically two tests done: LFTs and ultrasound. The LFTs are the liver function test. The bilirubin will tell you that the type of jaundice is it a direct bilirubin or an indirect bilirubin. Usually, if the direct bilirubin is elevated, that means it's liver-related cause. Then we have the liver enzymes, the SGOT, SGPT, alkaline phosphatase. Usually in viral hepatitis, in the early phase, they go up into 1000, 2000, like that. So the elevated enzymes will show us that there's an ongoing liver injury. And then we also get an ultrasound done. Ultrasound done, we basically look at the liver size. We look at the liver size: is it enlarged? Is it shrunken? Then we look at the any other problem like gallbladder stones, CVD stones, pancreatic pathology. Is there no other cause of jaundice? So this is the basic two tests we used to diagnose. If it's a viral hepatitis, there's no need for too many investigations. Acute viral hepatitis, we just follow up the patient with weekly LFTs, unless the patient becomes sick or something like that. There is no need for further evaluation. But if it is a hepatitis B or hepatitis C, then these patients need to be evaluated for chronic liver disease. Again, hepatitis B and hepatitis C, they're diagnosed on very simple blood tests: HbSAg, antigen for HbSAg, and anti-HCV antibody. These very simple screening tests, which hardly costs like 100 rupees or something, with which we can know that the patient has either hepatitis B or hepatitis C. If they have hepatitis B, hepatitis C, then obviously it's a much more complicated process. We look at the ultrasound, we look at has the liver already hardened, liver elastography, we do an endoscopy, we do the genotyping, what type of virus does he have and what is the viral load, and all these tests to work up for chronic liver disease. These of course will be decided by your gastroenterologist. See, like I said, you have acute viral hepatitis caused by hepatitis A, hepatitis E, and dengue, COVID. In those acute viral hepatitis, the treatment is actually no treatment. Keep the patient well hydrated. Avoid any drugs which damage the liver, especially the native medication. Just wait and follow up the patient. 99% of the time, most of the patients settle down without any further treatment. Just spontaneously, the liver has a phenomenal ability to heal itself. On the other hand, if you have chronic hepatitis, hepatitis B, hepatitis C, the options are a bit more complicated. So if we have patients of chronic hep B, hep C who come to us before they have cirrhosis, and patients who come to us after they have cirrhosis. So if the hepatitis B, hepatitis C is diagnosed before they have cirrhosis, the lucky patients, in them we evaluate them further. What is the type of hepatitis virus, C, B or C virus? What is the viral load? Is the virus actually replicating? And we can easily treat them with medication. You have like entecavir, tenofovir, redifovir. So many drugs are there for hepatitis B, as well as now for hepatitis C. Actually, till 5 years back, the treatment of hepatitis C was very difficult, but now with simple tablets, antivirals are available with a 3-month combination course of antivirals. Almost 99 to 100% of the patients we can completely clear the virus. So in the Hep B, Hep C, if you are detected, you go to a doctor, the doctor will see you, will check your ultrasound, your platelet count, your endoscopy, make sure that the liver is not scarred yet. Then in hepatitis B, he will decide for some patients that the hepatitis, actually some patients have something called, in hepatitis B, a lot of patients have carrier state. That means the virus is in your body, but it's not actively replicating, it's not damaging your liver. So there is no need to treat them. Those patients are just hepatitis B carrier state. That's 95% of the patients. In 5% of the patients, for various reasons, the gastroenterologist will decide to treat the hepatitis B. But in hepatitis C, once the doctor sees and there is no cirrhosis, then he will start the treatment for hepatitis C and clear the virus. But the situation differs if the patient already has cirrhosis. Once you have cirrhosis, the problem is that the liver is already damaged. So these patients will inevitably go to liver failure, liver cancer, and liver transplant. So then it becomes a totally complicated thing. The gastroenterologist will put you under 3-month follow-up. He'll bring your virus load to zero with the medication, but you need to be under long-term follow-up, and you need to screen yourself every 3 months for liver cancer. And eventually, if your liver starts failing, you may need a liver transplant. So that's why, because once you have hepatitis B, C infection, the infection can go undetected for 10 to 15 years, and then the first time you go to a doctor, you may already have cirrhosis, and it's too late, because then you'll inevitably develop a liver cancer or need a liver transplant. If not, the patient dies. Because of this is a big problem, and like I said, the prevalence is a huge disease load in India, 4 crores of Hep B and 1 crore of Hep C. So how do we prevent these things? Let's talk about hepatitis B, hepatitis C first. One is, every person should get himself checked for Hep B, Hep C if you have not already checked. So in your routine blood tests, in your biannual health checkup or something when you're going, you can just add these 2 tests, hepatitis B antigen and hepatitis C antibody. If it is positive, you can go meet a doctor. Okay. Then in terms of protecting yourself from hepatitis B, hepatitis C, things of IV drug abusers, people who are abusing IV drugs, people who are getting too many tattoos, especially in unhygienic surroundings, people who are in the health industry, continuously exposed to blood products and needles and injections, like doctors, nurses, paramedical staff. Then people who had multiple transfusions, people who are on dialysis, all these groups of patients are at risk of hepatitis B and hepatitis C. So safe sexual practices, avoiding multiple sexual partners, practicing safe sex, using protection, using a condom, all that. And more than that, sometimes, in addition to all that, sometimes people who had surgery or multiple transfusions, without your knowledge, you may contract hepatitis B. So as a part of your general health checkup also, you can get a hepatitis B and a hepatitis C checkup done. And once you get the checkup done, obviously you go to a doctor and he gives you long-term precautions. The other thing is, patients who have hepatitis B, hepatitis C, avoid alcohol, avoid obesity, because alcohol leads to alcoholic hepatitis, obesity related to fatty liver and hepatitis. So these things work together to damage your liver. So a healthy lifestyle, safe sexual practices, avoiding IV drug abusers, drug use, and regularly getting checked is important for hepatitis A and E. For the other viral hepatitis, of course, some are transmitted by fecal-oral transmission. So good hand hygiene, unnecessarily eating outside too much, you should avoid, because there's always a risk of contamination. Then drinking safe drinking water. Make sure that you get safe drinking water in your house, and wash the vegetables and all that thoroughly before you eat them. All these kind of things will prevent fecal-oral transmission. Hepatitis A and E are fecal-oral transmission, and of course the mosquitoes and all that, they can promote dengue and all that. So you can all those precautions also you need to take. Essentially, mainly about Hep B and Hep C. Ideally, a healthy lifestyle, like I said, avoiding multiple sexual partners, IV drug users, and getting yourself checked, can prevent hepatitis B, by detect hepatitis B, hepatitis C at an early stage and prevent them. Of course, one important thing in prevention is the vaccine. Unfortunately, for hepatitis C, there is no vaccine. But I think in hepatitis B, after 2010, every child who's born in India at 6 weeks, 10 weeks, and 14 weeks, they get the hepatitis B vaccine. So make sure if you have the records, you get yourself checked for hepatitis B, C, E vaccine and hepatitis B vaccination. If it's not been vaccinated and you're in a high risk profession, better to get yourself vaccinated. It's a very simple regimen. 3 doses are given: 0, 1, and 6 months. Likewise, if somebody comes as hepatitis B positive in the family, then usually by touch or eating together, sleeping together, the hepatitis B does not spread. But if one family member has hepatitis B positive, it is better to get the rest of the family members checked for hepatitis B and get them vaccinated.